Next order of business today is our regular calendar. We have one item, Senate Bill number 2 by Senator Goodwin, an act relating to Health and Safety, Nursing Home Staffing, and Quality Care Act. Madam Whip.
Thank you, Mr. President, members of the Senate. I'm hoping that third time is the charm here for this legislation. For our new members, this is the third attempt of passage of this bill. The Senate has always passed it almost unanimously every year for the past 3 years, and the House, in their wisdom, saw fit not to move along with this legislation, but hope springs eternal. I think this might be the year for this very, very important piece of legislation. Mr. President, members of the Senate, this nursing home staffing bill is sorely needed to ensure nursing home residents have adequate care. Even prior to this pandemic, Rhode Island had a staffing crisis. We ranked 41st in the nation in terms of average number of hours of care given to nursing home patients. Our elderly and most frail residents and the nurses and CNAs who care for them need this minimum staffing standard. The existing staffing crisis in our nursing homes have been severely exacerbated by this pandemic. For too long, nursing homes have made profits by shifting more and more work onto the caregivers and providing less and less direct care to their residents. We heard testimony from caregivers who described being spread so thin as to barely have time to provide for basic needs for residents. One nurse described a resident who had to remain on a toilet for so long she was in excruciating pain because no one could get to assist her. When she started in the profession 20 years ago, 5 CNAs and 2 RNs cared for 32 residents. Today, about half that number, 2 to 3 CNAs and 1 nurse, care for those same 38 residents at her facility. They struggle to provide basic needs such as showering and grooming and assistance in feeding, and have no time whatsoever to spend with residents. There simply is not enough staff to provide the care residents need and so richly deserve. There is an unlevel playing field in nursing home staffing in Rhode Island. Many nursing homes staff at 4.1 hours per day or close to it, and I applaud those nursing homes in their effort. But some nursing facilities provide as little as 2 hours of care per day in a 24-hour period. I often say when speaking about this bill, I wonder how many Rhode Island residents realize that their loved ones in these facilities are not even getting 4 hours of care a day in a 24-hour period. In either case, the overwhelming majority of either well-staffed or poorly staffed nursing home still remains highly profitable. The lack of staffing in CNA is due to unreasonable workload and low pay. The Department of Health CNA registry makes it very clear that many workers become CNAs, but retention is a big issue. This is in part because they can make much more money in a minimum wage profession with far less stress. The Nursing Home Staffing Quality Care Act directly addressed these staffing challenges. This bill essentially, ladies and gentlemen of the Senate, does 3 things. As I said before, it requires that it provide a minimum standard of 4.1 hours of care per day for our nursing home residents. It provides a path to a living wage by requiring increases to Medicaid reimbursement to go to the frontline worker and wages. And lastly, it provides access and resources for more training, which is especially important for infection control. This legislation also requires better access to staffing data for the public who are considering going into a nursing home or sending someone they love into one of these homes. This also includes escalating fines for nursing homes that have chronic short staffing. Victoria Miller, a 24-year CNA at Hopkins Manor in North Providence, reminds us when she tells us, we take care of human beings. We don't take care of machines. We rush from room to room to give people care, and the patients are suffering. They are old, they are sick, they are infirmed, and they feel like they are suffering through this because no one is listening. She spoke of 3 CNAs caring for 44 patients at this facility in North Providence. They have to feed them, bring them to the bathroom, groom them, and they run for hours from room to room to room. She left us and asked us all to just close our eyes and picture your loved one in a bed, waiting for assistance, patiently waiting because they know that the staff is short. Do you want that for your loved one? And we should all be asking ourselves this here today with this legislation. Is that what we want for anyone, especially someone we love? And lastly, I'll just close by saying, for years and years, nursing homes have taken every last penny in a lot of circumstances of Rhode Islanders' money. Folks that worked for years, sometimes 2 and 3 jobs to provide a home, and at the end of their days, they're forced through no fault of their own to have to go into a nursing facility. And as we know, they strip them of every last penny for this care that they worked a lifetime for, leaving them sometimes with just a few dollars a month for essentials. Ladies and gentlemen, this legislation, in my opinion, is most definitely needed, and I look forward to its passage. I ask for your support. Thank you, Mr. President, members of the Senate.
Before I take seconds on Senator Goodwin's motion for passage, Senator Algier, your light was lit? Your second light? Okay. Senator Goodwin moves the act, seconded by Leader McCaffrey. Senator Lombardo, Senator DeMario, Senator Chacon, Senator Sosnowski, Senator Anderson, Senator Burke, Senator Archibald, Senator Cano, Senator Corkin, Senator Bell, Senator Aptakis, Senator Murray, Senator Golden, Senator Oyer, Senator Valverde, Senator Coyne, Senator Palmer, Senator Lombardi, Senator Coleman, Senator Lawson, Senator Mack, Senator DeMario, Senator Casada, Senator Chacon, Senator Gallo, Senator Murray, Senator Picard, Senator Casada, Senator Feeley, Senator Miller. Discussion on the act. Senator Morgan.
Thank you, Mr. President. Last year we had an issue with the state-run nursing homes not being included in this. Special question for the sponsor.
Sure, Senator.
Will the sponsor
will they be included in this legislation this year?
They are not, Senator Morgan, because the facilities, the state-run facilities, I'm assuming you're referring to maybe the Eleanor Slater Hospital or Zambrano. No, because they are not categorized as nursing facilities, not nursing homes.
Okay.
So they're not included.
Okay, thank you.
You're welcome.
Senator Dela Cruz.
Thank you, Whip Goodwin, for introducing this legislation. Caring for the most vulnerable in our society is what government should do. And I'm so happy that so many of us in this chamber are willing to advocate for those that are down and out and downtrodden. However, I did receive a call from a member of the union that works at Zambrano Hospital, and she said, how can you pass this and not include state-run facilities? Those individuals need just as much care as any individual in a private-run nursing home. And I agree with her. But then there's also the issue of an unfunded mandate. While I do agree that we do need to make sure that our nursing homes are properly staffed, if we as legislators are going to mandate that, we should put it in a fiscal note as well. Because we can't ask nursing homes to do something in which we're not willing to provide funds to back them. Thank you.
Thank you, Senator Dela Cruz. Senator Mendes.
I wanted to especially take some time to thank Senator Goodwin on this piece of legislation and championing it for so long year after year. As someone that was one of those loved ones that had a loved one in a nursing facility, I know firsthand how important this piece of legislation is. And we are responsible as a governing body to care for the people that care for the people, and they're doing the hard work. And it tells us a lot about who we are and who we decide to be as a state when we make decisions regarding the most vulnerable among us. And I feel as though that this should have been taken care of a long time ago, and I'm very, very eager to support you in all of this effort, particularly now in a pandemic where I know firsthand I lost my father in a nursing facility. And those nurses and CNAs were the first people to update us. They were working around the clock. When we cried, they cried. And their wages and their care should be our top priority. Many of them are working multiple jobs to make ends meet, and putting their life, their body, and their mental health at risk every single day to care for the most vulnerable among us. And the very least we can do is make them a priority when they make our seniors and our most vulnerable the priority of their life every single day at the expense of their body, at the expense of their family's budget, at the expense of their time. And I think that we would be remiss to let another day go by without addressing this issue. So thank you, Senator Goodwin.
Thank you, Senator Mendes. Senator Bell.
Thank you so much. I want to start by commending not just the sponsor and everyone in this chamber who's worked so hard to move this legislation forwards, but also the incredible work of the nurses throughout our state who have poured countless hours into working to move this needed piece of legislation forwards. The stories you've shared with me have been heartbreaking and moving, and your incredible work to put in those extra hours to advocate for your whole industry after a long day of really difficult work made much more difficult because of the shortage of staffing, shows your commitment to helping our state. But I also want to address the nursing home owners. I sat on the committee and listened to 4 hours of testimony from nursing home owners who all said pretty much the same thing, that the nursing home industry is in crisis, that nursing homes are shutting down all across the state. And to that I say, yes. Yes, they are. Yes, the industry is in financial crisis, and that is why this legislation is so needed, because we know that when an industry is suffering financially, that is when it is most necessary to have protections for workers. That is when it is easiest to take the pain out on the people doing the work. That is when worker power is most necessary. That is when it is most important that the outlet valve not become short staffing, not become underpaying. And that's why this legislation is so needed. But it is also true that the crisis facing the industry is real and a crisis we need to do something about. And I stood up here on our budget vote at the end of, for the 2020 fiscal year in June of 2019, and I voted no. And one of the main reasons I voted no was because the nursing homes took yet another Medicaid cut. We've been cutting the nursing homes year after year after year, and it is deeply historic that our most recent budget did not cut Medicaid. It's incredibly important, and for that, I'm deeply grateful. But when that was happening, we didn't hear the nursing home owners pouring in hours and hours of testimony. We didn't see them organizing. We didn't see them fighting like they fought as soon as we threatened to take away their ability to just dump the pain on the workers. And look, I have a solution. For the nursing home owners, I've got a solution to your problem. $300 million a year. You know, when we passed that budget that created that final cut to the nursing homes, we also did something brilliant and something historic. I have to commend the hospital's brilliant lobbyist for how they put this together. But we showed that we can provide this funding at no cost to the Rhode Island taxpayers. We proved that you can use the Medicaid shift. You can raise the taxes on the hospitals, reinvest those funds, and get the match and triple or quadruple your money so that the hospitals get new federal money at no net cost to the taxpayers. We can do this for free to the Rhode Island taxpayer. We can leverage the federal government's power to create money. We can do it. And we can do the same thing for the nursing homes. And to those who say that in this case, because of federal rules, we might have to do it through a tax on the MCOs, to that I say, great, let's make it the insurance companies who bear the very minor administrative burden. I think that's an extra reason to do it, even better. We've got a solution here. We've got a way to provide the funding that the industry needs, the funding to arrest the closure of nursing homes that has hit our communities hard. And if the nursing home owners are willing to advocate for this solution, a solution that won't cost the taxpayers of our state anything, they're willing to advocate for money to save their industry as hard as they're willing to advocate against this bill that will prevent the pain from falling on the workers, then I believe that we will be able to address the crisis facing this industry and create an awful lot of jobs. And yes, in some cases that may mean raising wages that CNAs get. It might mean paying them $30 an hour, which they deserve. It might mean in some cases that yes, the nursing homes have to fund worker training, as employers should. If there aren't enough certified CNAs because it's not a great job that pays you a completely unfair wage, then maybe the nursing home owners need to pay people to get that training. And yes, this costs money. Yes, money is needed to solve these problems, but money is something that we can get here, and that is the solution. But first, while this industry is in crisis, we need this law. We need this protection so that the pain does not fall on short staffing, the pain does not fall on workers, the pain does not fall on our patients suffering in our nursing homes. After we went through this crisis in our nursing homes with this deadly pandemic, we need this. We need this now. And then we need to fight for the funding, but now we need this law.
Thank you, Senator Bill. Senator Costa.
Thank you, Mr. President. I want to acknowledge that I will be voting in support of this bill. But I would also quote Stuart Hall, who British theorist, remarking on the mining movement during Thatcherism, said, "The struggle was right, the politics was wrong." I believe that this is the right struggle, but this is a war between big labor and big healthcare. And some of the folks that Senator Bell was alluding to are getting lost in there. Now, there's a working assumption that corporations in healthcare are getting rich off of all the money that we're pouring into the care for the elderly. And frankly, as a very brief member of the Oversight Committee, what I do know is that we don't have great data on this. And so while I will pass, and I assume this bill will pass our chamber today, what I encourage the rest of my colleagues to do is focus on the other problems that this is related to. How much profit are corporations making off of the public dollars that we're investing in the health care of our seniors? We're not very clear on that yet. And it's probably true that larger corporate healthcare facilities are making a lot more money, a lot more of our money off of our family members than some of these smaller ones. And we should know that. And we should be able to prove that. It's our intuition, but we don't know for sure. And part of why we don't know is because we've been too caught up in this war between these two big groups. Groups that have spent more time fighting with each other than looking at solutions. Now, I'm a big fan of labor, but labor has spent the last decade rent-seeking and talking about wages, and not enough time talking about the structural conditions of their profession. That is a problem. And now it is on us to deal with those structural conditions. And we're going to do that, and we're happy to do that. But we also need to be working with folks who care about the integrity of the profession, not just the individuals in it. And so I'm here today to encourage us all to please consider further legislation that addresses the other issues that are underlying the issues that we're trying to address today. We're asking people to do more while we spent the last decade cutting funding or at least keeping it stable. So I would echo the comments of Senator De La Cruz, who said, give them more. We need to properly fund the institutions that need it and hold those accountable that are using us as benefits for their profit. And so I thank my colleagues today, and I hope that we can do more work to address this impending problem. I am trained as a demographer. I know that this is just a bigger problem. Once many of the colleagues here and their family members retire and these boomers move on to the next stage of their life, this is only going to get more expensive. And so if we don't figure out ways to address this now in a state that has a lot of young people and a lot of seniors, we're going to be in a lot of trouble in the next 15 to 20 years. So I thank you for your time, and I see you. Thank you.
Thank you, Senator Costa. Chairwoman Kano.
Thank you, Mr. President. I just want to commend the sponsor on this bill, Whip Goodwin. Thank you so much for fighting the good fight for 3 years. And I believe, just like you do, that this year needs to be it. One thing that I like to highlight is that you put this legislation before the pandemic hits. And if the pandemic haven't shown us that CNAs and nurses have been the heroes that have give so much of their time and care to our most vulnerable Rhode Islanders. So when is the time to protect them and to take care of them? I think that one specific important issue that haven't been mentioned that I'd like to highlight is that many of these workers are women that also have children, and women of color that have multiple jobs. And I just want to give a shout out to them because I do know that they have gone above and beyond before the pandemic, and they continue to be doing their job with a lot of care and passion for making sure that their patients were taken care of. And it's only right that we give them the safety standards and the protections that they need so that they'll continue not only to take care of the people that we love, but also to make sure that they have a good wage living so they can take care of their families. So I just want to say thank you, Senator Goodwin. I have been, supporting this bill since I got into the Senate, and I do think that you do it for the people because they take care of our loved ones. And I personally know that because I do know I have as well family members that have been taking care of these amazing workers, and it's time to do it now. So thank you so much.
Thank you, Madam Chair. Further discussion on the act? Hearing none, the clerk will please unlock the machine. If all members have cast their vote, the clerk will please lock the machine. There are 34 votes in the affirmative, 3 in the negative, and the act passes.